In today's video, we will be discussing 5 radiation therapist interview questions. But before we do, just a quick disclaimer, these questions are not guaranteed to be asked at your interview. I've pulled all of today's questions and answers from our website, mockquestions.com, where we brought in nearly 100 different professional interviewers to create all of our interview questions and answer examples. So in this video, we will dive into what I believe are our 5 best radiation therapist interview questions with answer examples. Let's get started. Question 1. How do you deal with patients who are especially weak or run down due to chemotherapy? Show the interviewer how you go above and beyond to be sensitive to the needs of your patients. Even though your role is more focused on the technical side of treatment, each patient interaction is an opportunity to make a positive difference in their life. Individuals dealing with cancer may find themselves spending most of the days going in and out of doctors' offices and hospitals. Display that you understand the weight of carrying such a life-threatening burden. Even if you haven't experienced it personally, you can still show empathy and be willing to listen to your patients' concerns. I take time to check in with my patients to make sure they are as comfortable as possible. I show them I care by following up with them when they tell me about their job, their family, or anything else going on in their life. Question 2. If a patient could not sit still during treatment, what would you do? Patients may have trouble remaining still for various reasons. Shakiness or anxiety may be a symptom of their condition or medications they may be taking. You may need to adjust them physically. You also may need to know how to talk them down if they are feeling excessively anxious or nervous. Discuss with the interviewer how you work hard to ensure patients are comfortable and still enough to proceed with their treatment. Helping my patients to remain calm by setting a tone of warmth and care tends to make a big difference if they are nervous or fidgeting. I speak in a soothing voice when my patients are nervous, and I remind them that I'm here to help and happy to answer questions. Question 3. How would your coworkers describe you? When you think about descriptive words for yourself, consider qualities that are relevant to this position. Think about your personality traits and how they correspond with some of the responsibilities of the job description. Reflect on some of the positive comments you have received from your coworkers in the past. Pick 2 to 3 traits that show off some of the strengths that will make you a fantastic asset to this clinic or hospital. Don't be afraid to brag a little, but avoid sounding pompous or overconfident. I often hear from my coworkers that they are energized by being around me. I try to stay positive even in the most discouraging situations. Maintaining an upbeat work environment is important when working with patients who are fighting to beat cancer. Question 4. How do you handle a larger than average workload? The interviewer wants to know that you can handle the workload required of you in this position and that you will not become overwhelmed when the workloads increase. Time management is a skill that takes experience and fine-tuning. As you learn to prioritize your daily tasks and start using tools and tricks to help you focus your attention, you become more effective with your time. It helps to understand your weaknesses and what types of environments aid in your productivity. Some people work better late at night, while others prefer early morning shifts. I make sure that I'm clear on expectations and required tasks, asking questions to clarify and prevent misunderstandings. I am thorough with patients, making detailed assessments before treatment and keeping track of time during visits. When I am more calculated with my time, while still ensuring complete thoroughness, I can keep on track during any busy day. Question 5. What questions do you have for me? It's always a great idea to have questions ready for the interviewer. Review the company website and other online resources to ensure the questions you have are not mundane or redundant. The last thing an interviewer wants to hear is a list of items you could have found the answers for from merely watching a video on their company site. Here are some sample questions. When would you like to have this position filled? How long has this role been vacant? Is this a replacement search or a newly created position? What is your favorite part about working here? What is the clinic's primary goal for this position in the next 12 months? Is there anything from my background and experience that I can clarify for you? What do you see as the most significant change in this industry over the past 3 years? Is there any reason why you would not hire me? Thank you for asking. I do have a few questions. What is top of mind when it comes to filling this role? Also, what types of career growth opportunities would follow this position? And lastly, do you have internal candidates who are also interviewing for the senior radiation therapist position? Thank you for watching. If you want more interview practice, head over to mockquestions.com today and get started.